On this edition of Being Well, Dr. Charlie Schuster from Back to Health Chiropractic and Natural Healthcare is here to talk to us about musculoskeletal health. What does that mean? It's basically how joints and muscles work together and for some causes pain and mobility problems. We'll learn more about how issues with feet, knees, hips, back, or shoulders may be alleviated if we know more about our biomechanics. We've got an informative program just ahead, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. AlphaCare, specializing in adult care services that range from those recovering from recent hospitalizations to someone attempting to remain independent while coping with a disability, chronic illness, or age-related infirmity. AlphaCare, compassionate professional home care. Additional funding by Jazzercise of Charleston. Welcome to Being Well. I'm with Dr. Charlie Schuster of Back to Health Chiropractic here in Charleston. We're talking about, I have to have you say the name because I can't.
Musculoskeletal healthcare?
Healthcare,
Yeah.
Okay. So for people who don't know what that is, give us kind of a broad overview of what musculoskeletal health is.
Well, that would be that branch of our health, Lori, that has to do with the nerves, bones, muscles, and joints. That really adds up to allowing us to be mobile and move freely.
Okay, so most people are good, thinking about heart health and bone health, like osteoporosis and brain health. Why do we sometimes forget about musculoskeletal health?
Well, and that's a great question. I think the old adage, out of sight, out of mind applies. And when it comes to our health, we've been wonderful about our preventive checkups and educating ourselves on the importance of them, such as blood pressure and cholesterol, and yet when we get up in the mirror, look in the mirror in the morning, and we look at ourselves, we don't see our joints, we don't see how they're aligned, we don't see our muscles being tight, we don't maybe notice our posture. We live in our bodies, not on them, and so to speak, and so we tend to just take the approach that if I feel good, I am, and that's where we run into trouble.
Okay, so if someone has some musculoskeletal health issues, what forms does that take? They probably come and see you. What are their complaints?
We do see that. I mean, they come see me. They might go to a physical therapist. They might have a personal trainer that they ask advice. We all have friends that are very helpful. So, I think that the big thing that we run into is people not really knowing who to see. But I think statistically speaking, most, when they have a real clinical problem, will see their general practitioner first or their pediatrician first. And then we go from there.
Okay. So this is really, as we were talking before we started taping the show, this is a big problem nationwide in our healthcare system. How large of a problem is it, and what kind of things are contributing to musculoskeletal health?
Well, it's a paramount problem. In the United States, the last time I checked, we were about 17th in countries, established countries, in our health and the quality of our health, and we have. In 2004, I know that the statistics were we had $830 billion in direct healthcare expenses and indirect healthcare expenses. The indirect healthcare expenses are things like missing work and lost wages And so it's not a stretch to say here in 2014 that this could equal a $1 trillion problem, which is, about 8% of our gross domestic product. So it's an astronomical issue, and so many problems happen when we aren't mobile. We all know that, the lifestyle diseases, heart disease, diabetes, these are, diseases that are spin-offs of lack of mobility. So it is a very big concern, and yet it's one that, when we think about it, when we go for our first physical, a scoliosis screening was probably a part of that, but we are not having anyone really look at us that's a specialist from an architectural standpoint to see if structurally we're sound. And of course, the earlier we intervene, the better.
Okay, so we often, and we've heard it in the news, we talked about it on this show, the way to get healthy is to start a fitness program and eat right. But you make a very good point. Maybe before a lot of that starts, you need to look at the structure to see if your structure is in line and is okay to move forward with that exercise program.
Absolutely, and everyone wants to wait till January 1st and then go out and join a gym or grab that Insanity video and get going with fitness. And the logical thing, if you think about it, is to make sure that I was using this analogy. If a highway has problems, I don't think the answer is to just put more traffic on it.
Right.
And so structurally speaking, and I work with a lot of athletes, and I go to the NFL Combine almost every year, and when you hear the team trainers speak about how they work together, and they have some basic tenets. They say before the strength trainer gets that athlete, that they want to make sure that the joints are moving correctly, that their muscles are firing in the right order, and they say they don't want to add speed, strength, or endurance to a faulty platform. And for us, maybe we're not looking to be, athletic, proteges or, Olympians, but we do want to be able to prevent injury. And I don't think we want, if we think about it, we don't want to undermine ourselves and then have to quit and then be discouraged and then realize and say to ourselves, this is not something I can do. So a basic biomechanical checkup is the thing.
Okay, so what does that involve?
Well, it depends on who you see, but there's really only one body. So, when we think about the major problems that we have, like disability and back problems that come from that disability, knee problems, shoulder problems, ankle problems, we need to take a look at why those are happening. And in physiology, there really aren't very many laws, mostly theory, and yet there is a law. It's called Wolff's Law, and this deals with the fact that when the body has any instability or weakness, that it lays down salts, and arthritic change is our body's response to stabilize that weakness. Unfortunately, that doesn't help our mobility.
Right.
So if we were to take a look, and just to make this as simple as I could, is if we were to drop a plumb line down ourselves at an early age and say, boy, I'm left weight bearing, right weight bearing, forward weight bearing, or backward weight bearing, we would already very, very predictably be able to know what conditions and where your issues later in life are likely to be. It's very telltale. And so that would consist of basically looking at our feet. And what we like to do, and there's a very simple way to do it. I suppose you could do it just getting out of a pool, though, and looking at your footstep.
Yeah,
but
wet footstep.
Yeah, so we look at balance. We like to know what percent of the weight's going on the right side of the body or the left side of the body. This is just simple stuff. If one foot's rotating in more than the other, that actually can cause your knee to rotate, your hip to rotate, your pelvis to become cattywampus, okay? And from there, it's a domino effect up. the body's structure. So we look at the feet first. We want to check the mobility of the ankles because, if you don't have good ankle mobility, it's only a matter of time before your hips are going to bother you. And guess what? The ankle and the hips are pretty bad neighbors. The knee is right between.
Yeah.
And so that's a real good place to start. And then we like to take, this is an important concept, we like to take preventive X-rays early on from the side and from the back. And we like to see if the gravity lines that we drop down the spine are right, left, forward, or backward. It can literally tell us whether you're potentially going to have disc problems or you're going to have arthritic issues with the facets, which are part of the spine that is in the back that causes so much sharp locking kinds of pains. And so these things very much affect the neck. And so you can see it really, it does, it works like that. And so it's about a 20-minute exam. It's very simple. And we like to measure the leg lengths, so if you've got a long leg or not. I mean, that ought to be pretty basic stuff.
So is all of that stuff just the way we're born?
Yeah,
for the most part?
It is. There's no two structure. Yeah, there's no two structures alike, and that's why we actually call it a structural fingerprint exam, just for lack of the fact that we really don't have a name for what this preventive exam that we need would be. But myself and many others in the physical medicine profession have started to come up with some really nice examinations that they've put together, and there's not a standard at this point. And so there is the first sports biomechanics department now in the United States, and in that department they are using a structural fingerprint exam, which consists of looking at the feet, X-rays from the front and back, of the neck and of the low back. They measure the leg lengths. They do some orthopedic tests for the ankles, knees, and hips, back, neck, and shoulders. And then they develop a preventive or a proactive plan for their athletes at this place.
So if a regular person comes in, not someone who's at the NFL Combine or training to be in the Olympics, they come in and they have this exam, and maybe they're not 16, maybe they're 36 or 46, and they're like, you have some of these biomechanical issues. What do you do? Are you just stuck with that, or what kind of resolution is there to some of that? It's a real luxury when someone actually comes in because hey, I'm here for my proactive preventive musculoskeletal exam. It just doesn't usually work that way, right? Because we're so pain oriented that we wait until we have a problem. We even wait a lot longer than we have the problem, and then we finally make it in. And so our first order of business is to relieve that problem. And sometimes that's just like stop the bleeding. Like, look, what are you doing that's causing it? And making sure that they're heating or icing, or which one is most necessary, taping them in such a way that they can heal correctly, etc. But once we are out of that acute phase, then we have to say, now, are you interested in a more proactive approach to your musculoskeletal health? And that's where people, when we look at, we tend to think about our expenses right now, but and I'm not a financial advisor, but I know that the more we put in early proactively, the better we are. And so what we tend to do is we tend to think about what our insurance covers, and health insurance is a whole nother that's a whole other
topic.
Show.
but it, that's where we start to take a look and say, now you may need orthotics, because you have flat feet, these are some exercises that you really should try to do, and here's how you want to go about it so you don't cause injury. And we have a saying, in our clinic, we try to teach people to fish instead of giving them the fish. In other words, we have a kind of an open area where we encourage people not to sit in chairs, because that's the whole thing too. And when they're waiting for treatment, we like them to be doing their mobility exercises, and that way they become experts on their mobility. And so basically to answer your question, we try to get people more aware so they can slow that degeneration process down. So
Because we're degenerating whether we like it or not.
We are, and
Sadly.
and here's the thing. I want to give people some encouragement here, because if you look at A.J. Guyton's physiology textbook, 8th edition, if you start looking at joints, synovial joints are those kinds of joints like our knees and our spine and our shoulders. They have fluid in them, and that fluid keeps them healthy. And in that textbook, it states that we think that those joints should last about 120 years, okay? So if that's the case, and we've got 80, 90, or maybe even 100, I'm even being optimistic, we've got a little leeway there, So it's never too late to start reintroducing some mobility. Take, for instance, your hip, okay? It's a round joint. It's a round joint. In that joint, there shouldn't be any corners. Yeah. It's round. So there's some exercises to tell you where those corners are, and then we may need to slowly sand them down, slowly.
Yeah.
But start to give that hip a little more movement than just this. I don't know if you guys could see that, but that's what we do. We sit and then we walk, and once in a while, whoops, we do this, but we aren't really ever working those joints.
So it's not immediately you need surgery. It can be things like orthotics, some strengthening, stretching, that sort of stuff.
It can, and I can't emphasize enough the importance of, joint dysfunction is the first step in degeneration. So if the joints are not working correctly, exercise is not enough. And that's where we tend to think it is. And the reason every NFL team and major league team has team chiropractors isn't to save the world. I mean, our little job, guys, is to keep the joint moving correctly. And the full range of motion in the joint is where it starts. And if it has that full range of motion, it's more likely to move better on its own. And then, to use another analogy, we can do more interior decorating because the studs are up and the foundation's laid.
So I want to ask you this. If you have a joint dysfunction, say you got an issue with your hip, what comes first? Do the muscles react to that, and that's when you get all that muscle tightness because they're trying to protect the joint, or is it vice versa?
Well, that's the old chicken and the egg, okay?
What comes first?
But I'll tell you that, one of the things we deal with so often in physical medicine is trigger points. These are really sore points in the muscle where lactic acid is building up. And those aren't because we caught them from someone. They're not an epidemic in that way. They're not infectious, but they are an epidemic because if the joints aren't moving correctly, the muscles do tighten up. And when they tighten up, they give off more lactic acid, many times than we can clear out. And we clear that lactic acid out with activity and blood carrying good oxygen. But there are some corners in the room, so to speak, where we get cobwebs, and we have muscles that just don't have a lot of blood supply in certain areas. And so we need to know where those are. It's basic owner's manual stuff.
It's
in
just
fact,
like when you get your car, you get your owner's manual.
It
Unfortunately,
is.
our bodies don't come with one.
It is. In fact, I would just love. In fact, if we could have advanced PE, and I hear that some schools have it. I think it would just be so nice if we could learn where those corners are and how to keep the cobwebs out of them, so to speak. Kind of like flossing. I think we're taught well how to do that, but we don't learn how to floss our own muscles and joints,
I want to talk, as we close out the show, about getting to young athletes and young students sooner, but I want to ask real quick, what are some things that we might be unknowingly doing? Like maybe I'm thinking shoe choice and sitting. That's actually creating some problems for us.
Yes, and thanks for giving me an opportunity to talk about this.
I won't show you what kind of shoes I'm wearing today because they're a little bit of a heel on.
I keep saying I think I'm going to do a YouTube channel at some point. I don't do that, but because I do it all day, I show patients how to unsit. And I mean, I'm sitting now, and for any period of time that we're sitting, we're really changing our neurology and our wiring, and so we need to unwire on a regular basis like we need to floss. And if I could write a book, it would be Unsit.
Unsitting.
Yeah, it really would. And because that's our number one detriment as I sit here now.
Is we sit too much?
Yeah, it's so hard on us. And so, we tend to sit, I think, 33 years, the average American in our life. So that's an important thing. And then, mobility exercises, and I don't mean just come up with this 30-minute crazy thing that you got to move every joint in your body. And, but the basics would be ankle mobility, hip mobility, back and shoulder mobility exercises. And I think it's important to keep those joints aligned. I think that's a very critical step that many people are missing. And so I think that, those are some of the things, shoes and foot type, I've got to say something about too. Because, if you go to a shoe store, and that's what they do, they can help you with this. If you catch someone who's there, and they're also in college and, they're maybe just there a couple hours a day and, putting some time in, you might have to do a little research, or you can ask your doc, especially your musculoskeletal expert. And there are 3 basic foot types, and so a person needs to know whether they pronate, whether they supinate. Supinating is when you have too high of an arch. That's not a good thing either. Or if they have a normal foot, how to maintain that, because it does.
Your arch kind of flattens over the years.
Absolutely does. So you need a real cushion shoe if you're a supinator. You need a motion control if you're a pronator. And then the really good shoes, they have degrees of these. So you can find a good shoe, and that's an important thing to do.
So I'm guessing you don't advocate for those flip-flops.
Flip-flops, oh my.
You see
we're in
college town, we see a lot of young college girls wearing flip-flops.
Yeah,
and guys
we do.
Too.
Oh my gosh, talk about creating foot problems later in life. In order to have, you can't have a normal gait. I challenge you to have a normal gait in a flip-flop. And then you tend to grab them, and it creates a real contracture of the toes, which isn't a pleasant thing later in life. So those, and of course high heels, which most guys don't have a problem with. So.
Well, that's kind of what I'm wearing today. All right, in this last minute or so, we want to talk a little bit about the importance of actually getting to our youth about biomechanics before they see injuries that are going to afflict them later in life. And you talked about advanced PE and getting young people and parents knowledgeable about biomechanics.
Yes, and in fact, I've taken a kind of a new personal mission with this. I've joined a group called Concerned Parents of Young Athletes. Sepoya is the name of the group, and really the whole point of it is to help myself learn how to educate people, because it's a real challenge. And it is important that we intervene early. I mean, orthodontists have done a wonderful job of explaining the importance of alignment with teeth. We just haven't gotten there when it comes to explaining the importance of alignment with our bodies and our structure. So the earlier we find these things out, and I guess myself, before my kids go in and start working out with their teams, they'll have a structural fingerprint evaluation, because I want to make sure that they're not going in there and setting themselves up for injury. And so I think early on, seeking that is a really nice way to start your kid and to save them lots of trouble down the road, because we can start before the degenerative process begins and really halt that and make sure that that child has the best chance of being mobile later in life.
Right.
And not having these little catchy things happen. I see a lot of really healthy people that end up with an arthritic hip or need a hip replacement.
At 45, 50, those high school sports injuries are coming back.
These are not infectious things they caught from people. So, the earlier we intervene, the better. And not to discourage anyone who's older. I think there's today,
hope for us older people,
honestly,
right?
today doesn't have to be the best day of the rest of your life.
Right.
I mean, you can get after it and really slow that process down. And who knows what it would have been if you didn't, So that's a great question.
All right. Well, Dr. Schuster, thank you so much. We're so happy to have you on Being Well and talking about biomechanics and musculoskeletal health. I got it right.
We've got to come up with another way to pronounce this.
It's hard to
You're
spell,
welcome.
too.
You're so welcome, and thank you for having me on, Lori.
Thanks. Vaccines.
They've all but wiped out terrible diseases like polio and measles in the United States. But that success has made many wonder if they should bother to be vaccinated against them anymore. Dennis Doda has this report from the Mayo Clinic News Network.
The ability to vaccinate against disease is heralded as one of the greatest medical advances of modern civilization.
Hand washing before surgery and clean water supply. It really ranks right up there.
Dr. Robert Jacobson is medical director of Mayo Clinic's Community Health Immunization Program. He says we may be surprised to learn getting vaccinated is largely voluntary.
There are for civilians no federal or national requirements for vaccination. When you hear about mandates or requirements, you're actually referring to school, daycare, and college rules.
In the U.S., a group of scientists and physicians called the Advisory Committee on Immunization Practices recommends which vaccines will do us the most good, from infancy through old age.
Now, what's on that list? We have measles, mumps, and rubella, of course, diphtheria, tetanus, and pertussis, flu vaccine, pneumococcal conjugate vaccine, the meningococcal vaccines. We have hepatitis A, hepatitis B.
Dr. Jacobson says while studies have proven there is no link between autism and vaccines, some parents still have concerns.
And that question mark that has been raised has been harmful enough to cause some families to choose not to get vaccinated and have left their children and, frankly, members of their community at risk for measles.
Lax attitudes about getting vaccinated allowed a measles epidemic to explode in France, with 14,000 cases in the first 6 months of this year.
Frankly, across Europe, 33 countries are now suffering outbreaks of measles.
And finally, adults need to stay up to date as well. Only 40% get their recommended flu shot. Chicken pox and mumps can have devastating consequences, and
every adult should have by now received a dose of diphtheria, tetanus, acellular pertussis.
Yet Dr. Jacobson says only 6% of adults have received that shot. For Medical Edge, I'm Dennis Doda.
Dr. Jacobson advises those over age 60 to get a shingles vaccination and those over 65 to ask their doctor about a pneumonia vaccination. Anyone traveling internationally should check to see if immunizations are required to enter the countries they'll be visiting. That's all the time we have for this edition of Being Well. Please join us again next time, and until then, you can check out our episodes online at youtube.com/WEIU TV.